Grounded theory is, in some ways, I think, a sort of simple methodology, but also is a bit complex as well. And some of the complexity, I think, is around some of the debates about what grounded theory is, and particularly the debate between its founding authors, which I think somebody who's doing grounded theory can be a little bit confusing. So I am going to talk a little bit about that, not to sort of suggest that the one way is better than another way of doing it, but there are competing paradigms and perspectives when it comes to grounded theory. And it's, I suppose, useful just to have a handle on that when you're deciding how you're going to do grounded theory, if you are going to do grounded theory. Okay. So let's start off with the basics then. What is grounded theory? Well, the aim of grounded theory is to generate or discover theory. And that's in the words of Glaser and Strauss, who are the founders of grounded theory. And I suppose that makes it different to some other qualitative methodologies where the aim might be around sort of rich description, you know, a full exploration of people's experiences. That grounded theory, I suppose, wants to take it that step further to actually look at generating theory. And it can be defined as the discovery of theory from data that's systematically obtained from social research. So this is not theory generated sitting in a library. This is theory that's generated and developed from empirical data, mostly empirical data, but you can use other data sources as well. So this is about grounding theory in data, which is exactly what it says in the 10 in many ways. Now, as I'm going through this, I'm really happy if people have got a question about the kind of the slide I'm on, but it might be more useful for me to make sure I kind of get through the whole talk. So if there's any kind of points of clarification, then please ask. But is that all right, just to leave most of the discussion maybe to the end? Yeah. But I am happy to stop if you need to. So when might you use something like grounded theory? The focus of the methodology is around uncovering basic social processes. And it's ideal for exploring social relationships, the behaviour of groups, and particularly maybe where there's been little exploration of the factors that affect those kind of underlying social processes. And Glaser in 1978 suggested that it was about getting beyond conjecture and preconception to exactly the underlying processes. And interestingly, he even goes a step further and suggests that actually that can be very useful for professionals when they're intervening to really understand what's happening. I'm not sure if all social researchers would suggest that there's got to be something to intervene at the end, but it is certainly a place that it can be used. I think, like all qualitative methodologies, it's probably helpful just to look at where grounded theory has come from, how it was established, and I suppose where it's going to now, which I think is important. It was developed in the 60s by two sociologists, Glaser and Strauss. Glaser's still alive, Strauss died a few years ago. And it was developed in the School of Nursing in the University of California in San Francisco. So that's why a lot of grounded theory still is within healthcare areas, although not exclusively. It's used a great deal within sociology and sort of business studies as well now. But certainly the foundations of it were within healthcare, and particularly within the School of Nursing. So that's why a lot of nurses have carried on using it as a methodology. And they were doing some research in California, looking at the awareness of dying in hospital wards, and looking at kind of awareness of dying and the kind of, I suppose, the kind of social worth of people as well. And it's a really interesting book. And if you're interested, it's still a kind of very classic piece of sociology to be looking at. and a really interesting read, and particularly I think relevant to maybe to people who are working in healthcare. I don't recognise anyone here, so I suspect very few of you will be working in healthcare. But the grounded theory is very much influenced by symbolic interactionism, which is the kind of, I suppose, from the kind of Chicago School of Sociology, and I suppose most famously written about by Bloomer in '69. So it's very much influenced by this, and I suppose the main issues of symbolic interactionism are the fact that human beings act towards things on the basis of the meanings that they have for them. So things or people, concepts are not kind of atheoretical, that people interact with them on the basis of meaning. And the meaning is derived from and arises out of social interaction that people have with those things or people, and that they're also modified through an interpretive process used by the person in dealing with the things that they encounter. So this all sounds very kind of interpretivist, sociology, but in fact, the kind of, I suppose, the epistemological basis of grounded theory is, I would say, a bit more kind of objectivist, and some people have even suggested positivistic. So it's interesting. I'll come back to this issue, but although they use, I suppose, a kind of theoretical perspective, which does indicate constructing concepts and phenomena, that actually the way that the research was developed, the approach was developed, may not be quite so interpretivist. So suppose in the 1960s, and many of you will know this already, but there was a real move from a kind of a natural science sort of paradigm as the foundation of social research. And sociologists started looking at new ways of investigating the social world. And I suppose this is the period in which Glaser and Strauss are working. And if you look at Denson and Lincoln's kind of classic work, which looks at the kind of moments of qualitative research, they and I and many other people would certainly put grounded theory into the kind of modernist moment of that. So with a very much a realist ontology, and the epistemological perspectives are very much about objective truth, theories that are generalizable, testable, and verifiable. So again, going from that kind of warm and fuzzy kind of constructing data, constructing the social world, they come into it from a very kind of modernist, objectivist perspective. And I think what's really important within that is the kind of the place of both the researched and the researcher within grounded theory. And certainly with this more objectivist perspective, there's this idea of discovering theory, that it's out there as in a kind of objective, atheoretical or acontextual kind of issue. You go out and you discover the data, you discover the theory, you don't create it in some way. And the move in social sciences toward kind of postmodernism and post-structuralism has certainly resulted in grounded theory being attacked for these very objectivist and positivistic foundations. And what's interesting, if you read through the massive literature that Glaser and Strauss have written, they definitely start to take on the language of which is associated with interpretivism. Although I think a lot of people would still suggest that they've taken on the language, but possibly the foundations are still kind of quite objectivist. And certainly, I've never met Glaser, but I've worked with a number of people who work quite closely with him. And when you kind of try and push Glaser into saying, well, where did the grounded theory come from? What was the perspective? He tends to be very vague on exactly putting his finger on where this all came from. So so they're not kind of, certainly now he's not explicit about where that comes from. So so that was really where grounded theory came from. And so developed Glaser and Strauss, west coast of the States. And obviously methodologies move forward, and Glaser and Strauss themselves never really suggested that grounded theory was going to be something static that was never be moved on. So they never suggested that grounded theory was one thing. And Ian Day, who's based up in Edinburgh, I did my doctorate in Edinburgh in grounded theory, and he did some really interesting teaching on grounded theory. And he would sort of suggest that there are probably as many versions of grounded theory as there are grounded theorists, which in some ways isn't very helpful to the novice researcher when you're trying to go in and get a hold on what is this methodology and what it's about. So in itself, it's not brilliantly helpful. Something that I think is really important, and I think has been well documented and discussed within grounded theory, is the division in the 1980s between Glaser and Strauss. And I think this is where people start to become, I think, probably unhelpfully quite polarised in their views about grounded theory. People start saying, I'm a Glaserian grounded theorist, or I'm a Straussian grounded theorist. And as I say, lots of kind of bickering goes on. So in the 80s, Strauss kind of teamed up with one of his doctoral students, Julia Corbin, and they started to do quite a lot of writing about grounded theory and published their book in 1990, which is called The Basics of Grounded Theory. And Glaser was kind of none too happy about this, and they started to have a really very public kind of discussion about this. And I've got, excuse me, Glaser then published a book in 1992 called The Emergence and Forcing Basics of Grounded Theory Analysis. And in the foreword to this, he writes to Strauss, I request that you pull the book, The Basics of Grounded Theory Research. It distorts and misconceives grounded theory while engaging in a gross neglect of 90% of its important ideas. You wrote a whole different method to why call it grounded theory. It indicates that you never grasped what we did, nor study it to try and carefully understand it. And actually then finishes off, your pal Barney. And it's a really interesting debate, and I say much has been made of this, and it was a very public in the forewords to their books. So they weren't keeping this quiet at all. But again, those people who've worked with Glaser and Strauss have actually suggested that they did actually remain good friends during all of this. And I think it's probably a bit of a lesson to academics that you might not agree on a kind of methodological level, but you might actually still be able to be friends with each other in the end. But in Glaser's book, Emergence and Forcing Basics of Grounded Theory, he really criticised particularly the analytical techniques and the procedures that were in Strauss and Corbin's book, and actually goes as far to say that, he's torturing the data to get some meaning out of it. So he's really kind of, going into the real intricacies of the data to torture it to find something. He says you can torture anything and get meaning out of it. So it's quite a kind of forceful argument between this pair. So say Glaser in 92 suggested that Strauss and Corbin don't extend any understanding of grounded theory, and actually go on to develop a completely new methodology, which Glaser called full conceptual description rather than grounded theory. And what is interesting, Strauss and Corbin went to publish a second edition of the book in 98. And although it doesn't necessarily kind of respond directly to those criticisms of Glaser and other grounded theorists, it certainly is a less prescriptive book. And that's why this is a methodology where it's quite useful to follow through all of these books and not just pick up a second edition as if it's kind of, it's actually very useful to look at the first editions of some of these books and follow it through to see how things have changed. I think people looking back on this discussion really aren't entirely clear about this kind of this discussion and debate, and really whether the two schools of grounded theory really are that different. Kath Melia has written a really interesting paper, which was published in Qualitative Health Research in 96, called Rediscovering Glaser, which I think goes into quite a lot of this debate. And she might suggest that actually, really, are they that different, or are they actually, expressing the same ideas and in different ways? And it's really at the analytical level, I think, the differences really come, and I'll talk about that. And Kath was my PhD supervisor, and had worked with Glaser in the States for a while, and was a real kind of methodologist, and learned a lot from her. So Glaser and Strauss, bit of a division going on here, and to see people initially were quite polarized about which kind of grounded theory were they doing. Sort of since the kind of late 90s, there's been a very influential and I think different perspective around grounded theory that Kathy Charmaz from the States has been developing constructivist grounded theory. And she would suggest that by adopting a constructivist perspective on grounded theory, the research can move towards grounded theory methods, which are much further into the interpretive social science, which is consistent with the Bloomerian symbolic interactionist perspective, and without the existence, kind of assuming there's an existence of a unidimensional external reality. So really using kind of constructivism as a kind of epistemological kind of background to it has actually moved grounded theory on a great deal, actually, and does, I think, probably answer some of the criticisms of a kind of modernist grounded theory, and particularly answering the questions about what is the place of the researcher and the researched within the development of theory. So I would have said that the majority of people now who I see doing grounded theory are doing a constructivist grounded theory. Not everybody. I was doing a mock viva for somebody last week, a PhD viva, and she was using a very much a Glaserian approach. But it's there are multiple ways of doing it, and it's about reading through this literature, getting a sense of what kind of question are you asking, what kind of theory do you want to generate? Do you want to generate something a bit more objectivist, positivistic, a theory or the theory, whereas constructivist grounded theory kind of develops a theory that is one theory. There could be many of them, and it's about constructing that. And there's been a lot of people writing kind of probably in the last sort of 10 to 15 years about using other epistemological kind of foundations of research, and people arguing that you could come from everything from a kind of postmodern perspective to, as I say, a positivistic perspective. So as I say, the theory is then generated in construction between the researcher and participant, and the researcher is kind of explicitly part of that process in a way that kind of more traditional grounded theory, the researcher discovers in the data. So that's really a kind of overview of where grounded theories come from, and it's not enough time really to kind of go into much more detail than that about it. But I would suggest if you're interested in grounded theory, you go back to those classic texts and follow them through. But in some ways, that debate isn't helpful, as I say, for people who are starting out with grounded theory or considering it as a methodology. So I think a useful place to start is that Kathy Charmaz has suggested a number of features that she thinks, I'm not sure if I agree with her on all the points, that all grounded theories should have. And I will go through these and sort of think a bit more about the practicalities of grounded theory. So the first one is simultaneous data collection and analysis. The creation of analytic codes and categories developed from data and not from any pre-existing ideas, using something called theoretical sensitivity, which I'll come back to. The discovery of basic social processes in the data, using inductive kind of methods to construct abstract categories, the use of theoretical sampling, the writing of analytical memos between the stage between coding and writing grounded theory, and the integration of categories into a theoretical framework. Now, there's certainly one other thing I think should be added to this list, although I'm not sure if I would particularly argue with Charmaz on it, would be the construction of a core category. And I will talk about that, but I think that's something for me that's really missing in this list. So what about doing grounded theory then? Unlike a lot of other qualitative methodologies, I think we have some idea of how to start the research by identifying an area of interest related to social processes and avoiding theoretical preconceptions and using theoretical sensitivity. How you actually do it through analytical procedures and the sampling strategies that fit with grounded theory. And also, which is quite important, is when to stop. There's a way of doing that within grounded theory, which is called theoretical saturation. So kind of unhelpfully, Glaser and Strauss would, in their initial book, would have suggested that all is data, that everything can be used as data within grounded theory. And that includes both qualitative and quantitative data. They never kind of set out to say that this was a qualitative methodology. Although, in fact, I would suggest that most people would use qualitative methods because it does tend to be used in areas where we don't really know what's going on. So actually, it tends to be qualitative methodologies to get that kind of rich description and discussion from participants. It tends to be used within grounded theory. The majority of people, I would say, certainly now will use in-depth interviews to collect data. And this relies on sort of very open interviews and trying the participant to kind of raise the issues and lead the discussion. Although, and I'll come back to this, questions are often modified throughout the research to reflect emerging theory, and I will come back to that. Glaser and Strauss themselves in their work on awareness of dying used observational methods, and certainly in the kind of, you know, up until probably fairly recently, a lot of people would use observational as well as interview data. But certainly, you know, there are some ethical issues around observation now that probably weren't around at the time. And, you know, it's probably a little bit more difficult, like if you're working with patient groups sitting around in hospitals, to be getting ethical approval. So certainly a lot of grounded theory now is by interview only, rather than observational methods. Focus groups can be used, but aren't often used, but they have been argued that they are appropriate within grounded theory. But as I say, I think most people stick to one-to-one individual interviews to sort of fully explore things with individuals rather than using focus groups. And as I say, you know, it is possible to use quantitative data within grounded theory as well. So I'm going to focus on interviews because I think that's the thing that most people are likely to use. And within grounded theory, you tend to start with a topic guide of broad questions with some sort of prompts and probes that will help you, you know, thinking about your research question will help you kind of focus the interview a little bit. Although trying not to be kind of, you know, lead the person who's being interviewed, but have some broad idea of where you're going with it. And what's really important with grounded theory is the idea of concurrent data collection and analysis. And through this, you can start to develop categories or components of the theory pretty much from word go. So you should be doing an interview, coming back, having it transcribed or doing it yourself, and starting to look at what's happening in the data. And I suppose that you know, does bring up a practical issue in terms of, you know, a lot of novice researchers kind of like come back and they're really pleased, and I've booked in 10 interviews this week. They say, well, how are you going to look at the data in between? How are you actually going to operationalize this concurrent data collection and analysis? So it's quite useful to be kind of really thinking about that as you deal with the practicalities of your research as well. So from this concurrent collection and analysis, you start to kind of narrow down your area of interest and to try and fill out, we'll talk more about this in a minute, but you try and fill out the categories. So actually you go often from a broad kind of perspective around, tell me about your day in hospital today. And people start telling you about it, and then you realise that there are things that are kind of important. So you might go to the next person and say, tell me more about this. So you start from very broad and start to narrow down so that the questions really relate to the theory. So the topic guide or the questions you use will change. They won't be the same for every person, because you're really trying to focus on the development of theory rather than, as I say, this kind of rich description. And one of the ways that researchers do this is through something called theoretical sensitivity. And researchers become theoretically sensitive by immersing themselves in the data, trying to understand what the participants see as being significant and important. So there's this real kind of like immersion in what's going on, making sure you're transcribing, analysing, really understanding what's going on in every interview as you go along. So one of the issues around that is to try to start with as few predetermined ideas as possible, so that existing literature and theory, prior knowledge, can all be used to inform the development of the categories, but they shouldn't be forced to fit with the literature, and they shouldn't really be used to create any categories. So you're becoming theoretically sensitive to your data rather than coming in thinking, I think this is what's going on here. Now that brings us to the kind of slightly thorny issue of the literature review in grounded theory. And again, I think it's probably a bit of a myth, because again, if you actually read Glaser and Strauss's work, they never say that you should be some sort of tabula rasa who knows absolutely nothing about the area. But the idea is that, that you do start off with as few preconceived ideas as possible that drive your literature. And I think that one of the nicest ways I've heard this kind of concept put is to start off with an open mind, but not necessarily an empty head. I think realistically these days, I think it'd be very hard for people either to get ethical approval or for postgraduate students to pass through their first year report without actually having done a literature review. I would feel very concerned if this idea of just, I know nothing and I'm just going to go in and ask people stuff. I think probably people can disagree with me, but I'm not sure how acceptable I find that when you're, particularly if you're going in to interview people who are unwell or are in points of crisis in their life, to have no idea of what the issues might be for some of those people. But it's how you use that information that you have. It shouldn't drive what's going on, but it may well be there in the background. And literature can be used as data later on in the process and can be constantly compared with the emerging categories, as you would with other data, to be integrated into the theory. And I think a kind of useful test of this is that often grounded theorists do an initial literature review, partly to justify the research, to say that how can you justify that nothing's been done in the area if you've never actually looked at any other literature about the topic? But what you find is that lots of stuff comes out of the data that you never expected would come out. So you end up doing a whole other literature review as you go through your data analysis and the development of the theory. So I think that's a pretty good test to me of whether you're being driven by the literature or whether you're open to finding new things within the literature, because you can be sort of suddenly reading some point of social theory that you never thought you'd get to by interviewing people on a topic. So I think that's a pretty good test. But as I say, maybe in some institutions, in real purist grounded theory, then maybe you could get away without knowing anything about the topic area, but I'm not sure how sensible that really is. So one of the important aspects of grounded theory is around theoretical sampling. And I suppose it's a type of purposeful sampling, but with the aim that what data is collected next and how you find it is determined by the theory as it's emerging. So you start to think about where's your theory going, and who might I go and find who might be able to tell me a bit about that. So for example, the research I was doing for my doctorate a number of years ago was around how patients constructed how competent nurses were. And patients really who I interviewed were saying, when talking about technical competence, were saying, oh, we don't bother about that, we're not interested in that. And I thought this was really interesting because it's such a crucial part of competence. So this kind of dismissing kind of technical competence and the importance of that was coming out quite strongly in the data. So what I decided to do was to go and find patients who were having a really technical procedure done on a regular basis. So I went to speak to patients who were having renal dialysis, many of whom have self-managed previously and done their own dialysis at home. So they were people who were having a really technical procedure and could really see who was good at this or not. And they were quite enlightening as to why some other patients, really filled out that category around technical competence. The other thing I did was I went to a group of patients who had cystic fibrosis. So a lot of the patients I interviewed initially were kind of patients in sort of medical surgical wards who were in for kind of an acute type of treatment or spell in hospital. So I decided to go and speak to patients who, let's say with cystic fibrosis, who've had a long-term relationship with the hospital services, as those patients do. And it was fascinating to look at the differences. And one of the patients said to me, the normal rules of the ward don't apply to us. So I'm thinking, what are the normal rules of the ward then? And it was really interesting. So theoretical sampling can work really nicely when you're trying to follow things. Who might be able to tell me a bit more about this? And Charmaz suggests, and I would definitely agree with it, that theoretical sampling is best used when some key concepts have already been found. So initially you may just go to a kind of fairly random group of people who have experienced the phenomena, and then you can kind of move on after you've started to develop your theory to that theoretical sampling. Analysis, and again, I think this is where Glaser and Strauss, I think, particularly divert a bit. Glaser and Charmaz identify a kind of a two-step process where you do sort of line by line or substantive coding, and then once you've done that, you start moving up to a more theoretical level to conceptualize how those codes relate to each other. Strauss and Corbin use a slightly different terminology. They talk about open, axial, and selective coding. And I think it's at this axial coding level where things just, get extremely complicated in the way of linking concepts and conceptual families and coding paradigms. I won't go into too much detail about that. One of the things that's really important to do is to really keep codes active when you're doing the analysis. And what's helpful is to keep asking really active questions of the data when you're looking at things line by line or incident by incident, thinking about what is actually happening here, under what conditions does this apply, what is this data a study of, and what category does this incident indicate. I think that's a really helpful way of thinking about the data. Memo writing, I'll just talk very briefly about this. So you do your kind of coding and start to develop categories. And within grounded theory, the use of memoing is really extremely important. It's that kind of intermediate step between coding and the first draft of your study, because a grounded theory really isn't complete until you've done the writing to see how it actually all fits together. And so something like NVivo is quite useful for this because you can insert, which is a software analysis for qualitative data, and so you can add little memos into it and start thinking theoretically, what's this about? I wonder if this links to that, what's happening here, those sort of questions you can ask. And the memos also provide a really useful audit trail through your data, particularly to look at how you've developed theory. The core category, again, I would suggest this was really important, and Glaser would suggest that, without a core category, any effort in grounded theory will drift in relevancy and workability. And the core category is something that tends to account for most of the data, and most of the other categories tend to link with it in some way. And it's a much more abstract category than maybe some of the other categories, but still grounded in the data. I'd have to say, when it comes to it, how you actually get there is a little bit vague. But the kind of Laser and Strauss might say that it's you find it in the data magically, and Charmaz might say, well, you construct that with the data. So again, it's another kind of difference in point between them. When to stop? Saturation of concepts, and that's at the point where you can stop data collection. And that's the idea of when no additional data are being found, whereby the sociologist can develop the properties of the category. So it's all about developing the properties of the category, rather than thinking about, have I exhausted all the sources of data? So it's very much thinking about theoretical saturation. And it's always a real worry, this, because you always think, oh, maybe new conceptualizations are just hiding around a corner waiting for you. If I go back to my data, maybe something new will happen. And but I think that theoretical narrowing I talked about during the interviews and collection of and analysis of data probably do kind of mitigate against some of these new things suddenly appearing, you know, when you're 20 interviews into the whole thing. Rigor, always important with research, and it has been suggested that the weaknesses using the method have become equated with weaknesses inherent in the method. I mean, I read really bad grounded theory when I review for journals, and most of that is because people have not moved from a descriptive level up to a conceptual theoretical level. And grounded theory has its own criteria for looking at rigor and the quality of data. I was just going to, just very quickly at the end, tell you about the grounded theory I developed. And I think that it's helpful sometimes to see an example, I suppose. And there were sort of 4 stages to the data generation I used. So I did the first 8 interviews with kind of patients who were in hospital, because that was the people who I was interested in. I did 8 interviews to, I suppose, get a sense of what was happening, doing some analysis at the same time. And then I stopped for quite a few months, actually, to really think about the data, where I was going, what was happening next. And then developed the theoretical sampling strategy, and then kind of moved on. And I think it is a bit problematic, that, in terms of the practicalities, because particularly, you know, from my perspective, doing healthcare research, you've got to be very clear about who you're sampling from the very beginning to go through ethical approval. And actually, I had to go through twice because I needed to go and start seeing different people from different areas. So it's actually quite hard sometimes to write a proposal because you're not quite sure where this is going to go. And this was the theory, it's very small, that I developed, and I don't really have time particularly to talk through the whole thing, but my core category was something called Between You and Me, really, and it was kind of indicating that how patients conceptualize the idea of competence or good nursing is very much on an individual basis. And it's about how someone interacts and responds to me using their human skills rather than their technical skills that makes me consider and believe that they are good at what they do. But one of the real problems was that patients, therefore, find it very difficult to talk to people, because one of the ideas was that maybe patients might like to be involved in looking at sort of assessing competence of nurses, but people didn't want to have a public kind of expression of competence because of a lot of what was happening in those other categories, and the process of becoming a patient, becoming socialized into that role, and the power changes that made, the fact that, you know, the belief that nurses are good, nice, kind people working really hard for no money, that it's really hard to tell them that they're not good, and the fact that people go the extra mile, focus on the wee things. It was a study done in Scotland, so there was lots of focus on the wee things, the little things that were going on. And also that last category there, looking at, you know, the fact that only nurses could possibly assess what nurses do, and that particularly technical competence was very much seen as being in the realm of the nurses, so technical competence was assumed. And of course, if you're working in the NHS, you've passed a degree in nursing, you're competent, and of course there would be nothing to question there at all, which, you know, for those of us who have worked in the profession, I wouldn't necessarily agree with that, but that was the perspective of patients, was that of course they wouldn't be working in the NHS if they weren't technically able to do what they're supposed to do. So there were lots of kind of bits that came through these three main categories that sort of highlighted this idea of assessment of competence being on a really individual basis. I can assess what you do for me, and particularly the human skills and values that you employ to do that, but I couldn't go and assess anybody else. I wouldn't be able to do that. So I suppose that just kind of gives you an overview of what a theory kind of might look like, and don't have much time to talk about it. But I suppose I just wanted to finish on an example, if that was helpful.